Okay, so sex should be satisfying, but for some folks, it's actually the opposite.
The post-sex blues, the real thing. But Dr. Viviana with Houston Relationship Therapy is here to help.
Yeah.
So, I mean, how do you know if you really do have the blues and what causes it?
Okay, so what ends up happening is that, and this can happen more often with people who have experienced sexual trauma in the past, but this is after consensual adult experiences. Some people are experiencing extreme anxiety and depression, and yes, there are lots of causes for it. Sometimes it can be simply just disappointing situations, disappointing sexual experiences, but then the other piece of it can be post-orgasm. There are hormones that drop significantly, dopamine, serotonin, and that can be something that you experience physically, obviously, and it can come out as tears or just this overwhelming feeling of sadness. Also, stress can be a big reason why people are experiencing this. If they're on a heightened level of stress or anxiety, and then they experience this relief and release, then they can experience post-sex blues. And it's called post-coital dysphoria, in case you're wanting to Google it.
So how do you treat this?
Therapy, Houston Relationship Therapy. We work with people with all sorts of sexual issues, including PCD. But then the other piece of it is cognitive behavioral therapy. Couples therapy can also help your partner understand what's really going on. Because, of course, if your partner is very sad or even experiencing tears or sobbing, your body can go through all of that. It can be very concerning to your partner. There's also EMDR, which is eye movement desensitization reprocessing. Again, looking it up, it's EMDR. And very important, lifestyle changes can make a big difference too. If you're feeling overwhelming feelings of anxiety or depression, things like working on moving more, sleeping better, anything that you can do to take a break from life, whether it's a vacation or breathing exercises, grounding exercises as well, and of course journaling. If you notice any patterns of when this is happening more often than others, that could be really important for a therapist to help you to understand why it's happening and how to overcome it.
So how long does it typically take for them to get through this, move past it, and get back to normal?
So typically, you would have to have experienced this for at least 6 months in order for it to qualify as an actual disorder. But if you are experiencing this for even just a few times and you feel like, wow, this is really overwhelming, reach out. We can definitely help you with this. Yeah.
What else do people need to know about this or keep in mind moving forward?
It doesn't just go away. There are going to be extenuating circumstances that you need to get professional help for. Of course, talking to your medical health professional is always going to be a good idea. We want to share this sort of, these sorts of situations, whether it has to do with sex or not. If you're experiencing extreme anxiety or depression, that could be a sign of something much deeper. Yeah.
All right.
Yeah.
Very interesting. Thank you so much for sharing that.
All right, coming up next, the benefits of regular exercise for men and an effective workout class offered for free right here.